Good evening. My name is Dr. Chris Bird. I'm here on behalf of the Coastal Bend COVID-19 Task Force. It's December 21st, 2020. The task force has two objectives. The first is to address your concerns and questions about COVID-19, and the second is to enable evidence-based decision-making on behalf of our local leaders. Presently, there are several interventions in place. You're encouraged to stay at home, or at the very least, avoid indoor places with a lot of people if you can. Wear face coverings and social distance. Isolate when you're exposed or symptomatic. And I want to emphasize that symptomatic means experiencing any of the sort of symptoms that you might associate with the common cold or the flu. Immediately self-isolate, call your doctor, get tested. There's been partial remote schooling for the majority of the fall term, and we're at Open Texas Phase 3, which means that 75%, which is that businesses are operating at 75% of capacity, and bars are operating at 50% of capacity. This week, the transmission rate we're projecting has increased to 1.13. If you remember, last week we were at 0.9, and you can see that right here during the Thanksgiving lull is what I'm calling it, where from the week before Thanksgiving to the week after Thanksgiving, this is a 3-week period where the transmission rate seemed to drop below 1, which means that COVID was receding. And what this number 1 means would be for each carrier of COVID, they infect one additional person with COVID, and that would keep COVID at the same level that it is in the community. When you go below 1, COVID recedes. When you go above 1, COVID spreads to more and more people. But this Thanksgiving lull is over, and it ended early last week, and has indicated we're up at about 1.13. Now we need a few more days of data to see if this 1.13 is correct or if it's a little low and it needs to be updated to be a little bit higher. I wouldn't expect that this value would be above 1.35, which is about where we were prior to the Thanksgiving lull. But we're going to need some more data points to really dial that one in. Okay, moving forward to the results of the projection based upon our fit and calibration of the model to the data. Each black point here is a data point for the number of new cases of COVID in the Coastal Bend on a particular day. And the orange is our updated projection, which we detailed in the last slide. And what you can see is that the projection is for increase in COVID. And based upon this trajectory, shortly after January 10th, we'd expect that the threshold would be passed for businesses to roll back to 50% occupancy. Now that would be if we stay at the same transmission rate, 1.13, that we estimate is in place today. Depending upon how we behave, and Thanksgiving has proven this, the transmission rate can change, and then obviously that will change the projections. And at the end of the presentation today, we're going to talk about a few holiday scenarios, depending on how we celebrate the winter holidays, whether we expect that this projection is too low or too high. Moving on to the number of confirmed cases in total, we're at over 30,000 total cases and over 27,000 recoveries. And a COVID confirmed case is a case that's been identified with the PCR test, which is the gold standard for whether you have COVID or not. And that's the one where famously you get that long swab up your nose. The thing that I think is particularly noteworthy here is that we pay attention to the number of active cases, which has remained mostly level over the past couple weeks. But if the transmission rate stays above 1, then we'll expect that this number of active cases will spread, which is currently at 2,561 in the Coastal Bend. Moving on to the percent positives in the test conducted at the Public Health Department and the mobile testing stations, we're at 26% and 19% respectively. Now, we single out these testing sources because we actually know how many people tested negative and how many people tested positive, and for most of the other testing sources, we don't know that. So it would have an inflated percent positivity rate, but here these are not overinflated. These are the exact positivity rates coming back from these two data sources. Any way you slice it, it's much higher than we'd like it to be. We'd like it to be down here below 5%, like we were at the end of May. Moving on to the number of new cases per day in the 12 different counties of the Coastal Bend. Here you can see Nueces and this Thanksgiving lull where the number of new cases per day came down, but then turned around about a week ago and started increasing again. Now we're going to zoom in on the rest of these counties in the Coastal Bend. San Patricio looks like it's going really high right now, but they only report new cases on Fridays. So that's why that looks pretty high right now. You can see back to last Friday, this is higher, but we don't expect that this trend will continue. It's going to round off like it did back here before increasing again on this coming Friday. The other counties, as far as I know, they report their new cases every day. So B and Jim Wells are going up, as well as Duval, Aransas, Refugio, and even McMullen and Kennedy are up in the Coastal Bend area. And again, over here, you can see this Thanksgiving lull period followed by the resumption of the spread of COVID, not just in Nueces, but across most of the Coastal Bend. Zooming out to see the whole state of Texas, and we do this so that you can see what's going on in other parts of Texas. How do we compare here in South Texas to other parts of Texas? Right now, while no part of Texas is free of COVID, South Texas is on the low side of cases per capita, or cases per 100,000 per day. But again, this is still pretty high. So there's one region of Texas which is lower than us, and that's Northeast Texas here, where Longview resides. And then the whole rest of Texas has more COVID cases per capita than here in South Texas. Even in Northwest Texas, where they peaked in late October and early November, there's still more cases per capita there, and that's more new cases per day per capita than here in South Texas. So if you're traveling for the holidays, be aware that when you go to these other parts of Texas, COVID is likely going to be more prevalent than it is here. Moving on to the hospitalizations, the black points on the graph are the actual number of inpatients in the hospital with COVID in the Coastal Bend. So this includes all the hospitals in the Coastal Bend area. And then in orange, you can see our projection. And I think this is a good time to emphasize that we do not fit the projection directly to the hospitalization data. What we do is we fit the projection back to the cases, and then the model outputs what we would expect there to be for hospitalizations. Now, what this means, where our expectation is higher than what we're observing, is that there's fewer hospitalizations than we would have expected, and that's a good thing. One thing that the public health director thinks may be happening is that there's a lot of therapeutics that are being delivered right now that may be reducing the number of people that need to be admitted to the hospital. So that's a good sign where we have fewer than expected people in the hospitals. Despite that, we do expect that this number is going to increase, and it has been increasing for the past few days, and we expect it to increase further unless something changes with the transmission rate. So if the transmission rate stays at where we project it is now at 1.13, or where we estimate it is now, then this is where we expect the hospitalizations to go. Now, looking at the proportion of staffed beds in the hospital that have COVID-19 patients in them, we're at 10%. Now, the reason why this value, 10%, is so important is that if it hits 15% for 7 days in a row, that's the threshold for rolling back businesses from 75% to 50% capacity and closing bars. So right now, we're only 2/3 of the way to that threshold of 15%. Now, we were oscillating since the Thanksgiving lull from 10% down to 8%. Now we're back up to 10% again. Now that that lull is over, we expect that this number is going to increase if the transmission rate stays above 1. And we'll start approaching that 15% milestone or threshold. Looking at the ICUs, there's been a big increase in patients in the ICU over the past week. We're up to 57 patients at the last data point that I have. Out of 163 ICU patients overall in the Coastal Bend, that's more than 1/3 of the patients in the ICU being COVID positive. If you step back and look at this, you can kind of see a linear trend, if you will, since the end of October through present. If you look a little bit more closely, we're increasing along that trend and then really started to boost up, and then we hit the Thanksgiving lull, which is right in this area, and now it's ended and we're really starting to boost up again. It's actually pretty concerning how quickly these COVID ICU people coming in is, and hopefully this doesn't continue to increase the way that it is right now. Moving on, what you're seeing here is this last figure, but for every trauma service area in the state. So this little panel here is the same one we were just looking at on the last slide. The blue is non-COVID patients. The red are COVID patients in the ICU. This is from December 20th, and you can see in a lot of places in Texas, these are increasing. Here we are, here's Austin, Waco, Dallas-Fort Worth. You get the idea. If you're traveling somewhere in Texas and you're interested in how strained the ICU is, I think that this figure is, provides you with a good idea. If you see a lot of red and not a lot of blue over on the right-hand side of one of these graphs, that means that that ICU or the ICUs and the hospitals in that region are strained. Moving on to fatalities, they're definitely rising. The black points here again are the actual number of new fatalities per day in the Coastal Bend. And these fatalities are processed by the state on the death certificates. So they lag today by about 14 days. And right now with our new projection, with the transmission rate above 1, we expect that the fatalities will continue to rise for the foreseeable future. Again, this is something that is controllable depending upon how we celebrate the winter holidays, and we're going to get to that very shortly in maybe 2 slides from now. Lastly, we're at 831 fatalities confirmed by the state in the Coastal Bend from COVID. Right now, the fatalities are increasing, as you saw on that last slide, and here they are broken down by county. You can see right here, this is Nueces in purple, where the fatalities per day are increasing. You can see San Patricio right here, fatalities increasing, and in several other counties in the Coastal Bend, the fatalities are starting to increase. Okay, moving on to our holiday celebration scenarios. We spend a lot of time developing and parameterizing these models that simulate the pandemic so that we can show you what might happen in the future. And now, while we don't know exactly what will happen in the future, we can provide a pretty good estimation of what could happen in the future depending on how we act. Now, in one scenario, and there'll only be 2, but in scenario 1, we're going to look at normal holiday celebrations. What this would mean is if we go about Christmas, Hanukkah, Kwanzaa, New Year's 2020 the same way that we did in 2019 or in any other year, with multifamily celebrations, no masks, no social distancing. This is this scenario. We have a very high transmission rate. We're using the transmission rate that we observed here in the Coastal Bend in the summer outbreak. So we're not making up numbers. We're pulling this from data that we've seen here in the Coastal Bend before this year. And then secondly, scenario 2 is if we celebrate like Thanksgiving 2020. This is a model that's parameterized based upon the observed transmission rate, that's what RT is, in the Coastal Bend around Thanksgiving. Now remember, we went through this Thanksgiving lull where the RT dropped down to 0.91. And what that means is that COVID was receding for each person that got COVID. Some people might not pass it on to another person. And so if we see a repeat of that in the winter holidays, that's what this scenario is showing us what that would look like. Now let's take a look. First, with the daily confirmed cases, if we go to normal celebrations, we're looking at a huge spike in the number of new cases per day that would far exceed what we observed over the summer. And if we celebrate like Thanksgiving, we're looking at, for the most part, a leveling off of the number of new cases per day at a very high number, just below 200 per day, but nonetheless not spiking up to above 800 per day. And if you look at the spread around the model over here in the summer outbreak, if we went through something like this, it wouldn't be out of the question to have 1,000 new cases in a single day. Now, we're not saying that this is going to happen or this is going to happen. What we're saying is that this is what could happen if we go to a transmission rate equivalent to the summer outbreak by having normal celebrations, or if we celebrate like we did in Thanksgiving of 2020, which actually more people in the coastal bend than not did the right thing and didn't have those multi-family celebrations, and if they did it responsibly. Okay, looking at the inpatients, same two scenarios. Again, a large spike in the number of COVID patients in the hospitals. This would be a huge problem if we go to normal Christmas celebrations, normal New Year's celebrations, versus trying to emulate what we did for Thanksgiving 2020. The Thanksgiving 2020 scenario is much more palatable than the going back to normal celebrations. There is a difference. There is an effect of what you do on what happens with the number of people in the hospital. And so this is a good reason to try to limit your exposure or limit the spread of COVID this holiday season. And lastly, with the fatalities, while we don't see a drop in the fatalities or a big drop in the fatalities, if we celebrate like Thanksgiving 2020, if we go back to normal and celebrate like Christmas and New Year's, etc., 2019, we're looking at a huge spike in fatalities that would be bigger than what we saw over the summer. We certainly don't want to see that happen. And once again, these are not what is going to happen. These are what could happen depending upon the decisions that we make as citizens here in the coastal bend. So in summary, the transmission rate is above 1, and the fall and now winter outbreak is continuing. We're into winter now. New cases and hospitalizations are increasing again after the Thanksgiving lull, and fatalities are continuing to increase. We might expect at some point, because of that Thanksgiving lull, a plateau in the fatalities per day before they start to increase again. And lastly, 2020 is not a normal year. We all know this at this point. Multi-household celebrations are discouraged during the holidays, and if you do have a multi-household celebration, follow all those same rules that we talked about at Thanksgiving. Open up the windows, try to have it outside, wear masks, social distance, do it over a Zoom session. Do whatever you can to try to mitigate the transmission of COVID-19. If you have to go into the stores to go shopping, that last minute holiday shopping, make sure you're wearing a face mask, make sure you social distance. It's really important, and it does make a difference. So with that, I'd like to thank you for your time, and we'll be taking questions from now through Thursday at noon, where we'll be answering your questions on a live stream on Facebook and YouTube. Our handle is @CBCovid. If there's any updates in that transmission rate, I'll also post them to our social media accounts on Facebook, Twitter, and Instagram. So on Thursday this week, because Friday is Christmas, on Thursday we're going to have our live question and answer session with myself and Public Health Director Annette Rodriguez, as well as Jason Lewis and Tiffany Anderson of the task force. And also I want to apologize to anybody that tuned in last week and didn't find us on that Facebook live question and answer session. We had some technical difficulties, but we've got those worked out, and we're pretty sure that it's going to go off without a hitch this Thursday. So thank you for your time, and I hope you have a great evening.